Graduating from nursing school is always stressful for every nursing student, but what's different about graduating nursing school in December? What do you need to know about the job market? What do you need to know about the credentialing timeline? And how do you prepare to have all of your ducks in a row while you're graduating from nursing school, studying for the NCLEX, looking for jobs, and dealing with the holidays? My name is Anna. I have been an ICU travel nurse for the last 2.5 years, and I am a first-year student registered nurse anesthetist, and I'm also a critical care nursing educator with confidentcareacademy.com. Today we're talking about what you need to know about the job market, what you need to do to prepare, and how you're going to approach finishing grad school as a December nursing school graduate. There's not as much information available online for December graduates. There's not as much information about the NCLEX, about the ATT, about jobs. There's not a lot of information for people who are graduating in December. You're also stressed out because you're dealing with the holiday season, traveling, midterms, finals, all as you're heading in to try to work on your credentialing. So I think what's one of the main things that's different about December graduates is that it's just a more stressful process. But let's talk about the numbers, let's talk about the job market, and let's talk about what it's actually going to look like as you're getting ready to graduate. Let's talk statistics. Okay, so this is from the NCBSN, which is the authorizing board that oversees everybody who takes the NCLEX. So this is just looking at the NCLEX RN. There's also the NCLEX LPN or the NCLEX PN, and LPNs are nurses. This is talking about people who are taking the NCLEX RN for the first time. So this is graduates from ADN programs, BSN programs, entry-level MSN programs, and accelerated Bachelor's of Science in Nursing programs. So all told, about 180,000 people graduate, about 150,000 people pass on their first time. And then what does it look like in December? So most graduates graduate in May, and most people shoot to take their NCLEX between June and August after graduating. So we'll show here the different statistics about people who graduate during May. And then you can see here that most people are trying to take their NCLEX over the summer. And then what's different for people who are graduating in December is that only about 40,000 people got their NCLEX taken in between January 1st and March 31st. So if you are graduating from nursing school in December, you're likely not going to get your ticket to test until January. You will be in this January to March area. So 40,000 seats out of about 150,000 is the people who are graduating in December. So much fewer graduates are shooting for those new grad residency spots that start in March or February. So it's a less competitive job market. Speaking of the job market, what's the job market look like in 2021 or 2022 for new graduate nurses? So from the Bureau of Labor Statistics, you can see that there's about 200,000 vacancies at the inpatient hospital setting. So we've got more jobs than our nursing school graduates to go around. There's plenty of work. You don't need to worry about finding a job as a new grad nurse. However, I want to talk about a couple of stats that I didn't really learn in nursing school, and I think it helps kind of set your expectations as you're looking for different jobs. So of the 5 million nurses in the United States, because LPNs are nurses, there's about 4.2 million RNs and about 900,000 LPNs, all of whom are nurses. So there's 5 million nurses in the United States. About 1.7 million work at the inpatient hospital setting. So 1.7 million are working in hospitals, which I think is really interesting to kind of consider. And then also looking at this, it's about 3.1 million nurses are actively working full-time or part-time who are currently employed working as a registered nurse. And then by specialty, I have been an ICU nurse, so of course I'm interested in this. There's about 290,000 critical care nurses working nationwide. This is including NICU and PICU as well. So about a little bit less than 300,000 ICU nurses. When looking for a new graduate job, you're hearing a lot about the nursing shortage. I think the biggest thing to bear in mind is that we don't have a shortage of nurses. We have a shortage of nurses who are staying at the bedside. And one of the biggest things that we can do to reduce that turnover, like the West Coast has done, is unionize and have really strong working conditions and have lunch breaks, pass laws about nurse to patient ratios, all of that stuff. I'm also going to show here, this is research from 2020 or from 2021 about the areas and regions of the country that have the highest nurse turnover. So post-COVID, we have seen an increase in nurse turnover within 1 year of starting. As of 2020 and of 2021, this data shows that the average turnover is between 25 and 30% of all nurses leaving their job within a year. It is really interesting to see though that on the West Coast it's the lowest, and that's because of their really strong unions. Anyway, all that being said, there's plenty of work out there. However, if you're one of those nursing students who is graduating and you want to start straight in labor and delivery or the NICU or in the PICU or in the ICU, you might have a little bit of an easier time finding one of those competitive new grad residency slots as a December graduate because, again, only about 40,000 people get licensed for the NCLEX in between January and March of each year in comparison with the whole 150,000 people total. So that was what you need to know about the job market. What about the credentialing timeline? Okay, so this is what you need to do as you are finishing up nursing school. While you are still in school, you can go ahead and you can register with your board of nursing to begin the licensing process. You are also going to go get fingerprinted with your board of nursing. If you are going to get licensed in a state where you are not currently living, just make sure that your address is going to match and be valid for where you're going to be moving to. So while you are still in school, about November or early December, you should be able to register with your state board of nursing and to get fingerprinted. So all of that information is ready to go. Then the next couple of things that happen are a little bit out of your control. You have to wait until your school gets the official transcript, and then you have to send that official transcript to the board of nursing to be eligible to continue and move forward. And then after they have your official transcripts and your graduation and your fingerprints and your completed registration, you have to wait for something called an ATT. This is authorization to test. Ticket to test, you might hear. I think I have a little conspiracy theory. I think that they went alphabetical in Colorado in 2019. I can't prove it, but you're just gonna have to wait. You have to wait for them to give you the authorization to sit for your NCLEX. And this process, after you've completed the application to getting your ticket to test, is just gonna depend on your state board of nursing, whether they do things paid by paper or online, and how long it's gonna take. But for me, it was about 6 weeks after I graduated that I got my ATT. Once you get your ATT, you can go ahead and you can take the NCLEX. Fun fact, you can take the NCLEX in any state. So I graduated from nursing school in Colorado. I was going to work at Johns Hopkins as a new grad, and I took my Colorado nursing license NCLEX in DC. So a lot of times in some states, you're going to have a shortage of testing centers. And if you happen to be flying somewhere else for the holidays, you're seeing some friends or family, or you're visiting a new job site that you want to tour the neighborhood and all of that stuff, you can register for the NCLEX in a different state. So I took my Colorado nursing NCLEX in Washington, DC. That's a fun fact. So that might help somebody out there. The last thing about the process with credentialing and all of this stuff is to just be aware of nurses and the nurse licensure compact. You can check out this YouTube video where I talk about what you need to know as someone who might potentially be interested in travel nursing in the future. This talks about nurses, this talks about the nurse licensure compact, and this talks about single state licenses as well. So go check out that YouTube video after you watch this one. And then a couple of things to consider about the job itself as a new graduate nurse are the nature of the orientation and the working environment. So you can check out this YouTube video where I talk about interview tips that helped me get job offers on the spot. And I also want to talk about orientation. So new graduate orientation needs to be at least 12 weeks, no matter which specialty you're starting in. And I believe that you can ask that question in an interview in a very tactful way. You can say something along the lines of, I'm so excited to work in this specialty. This is a patient population I'm really passionate about. I am interested to hear what the orientation process looks like at this facility and what resources you have to support new graduates as they learn in a new patient population. Say something like that, and then they will usually tell you how long you get on orientation. Anything less than 12 weeks is a red flag, to be perfectly honest with you. I would just make sure that you are going to set yourself up for your success by making sure that you're going to have a really thorough orientation so that you can do a great job doing the stuff that you love to do, which is taking care of other patients. And then in addition to the video talking about interview tips, I also will just say that Incredible Health is a really excellent resource for resume templates and also for cover letter templates if you're applying to a couple of different new graduate jobs. I'll have that linked down in bio and you can check out their resources in addition to all of the other help and services that they provide. All told, y'all have done such hard work. You're going to be incredible nurses, and I am so excited to meet you in the workforce. Please comment what you would like me to talk about next time or any questions you have about this video, and thank you for your support. Bye.